Hello, my name is Belinda. I am a therapist and coach with Be Kinder to Yourself Therapies and the host of our Compassionate Women's Health community. Today I've got Dr. Peta Wright, fertility specialist, holistic gynecologist, joining us. Welcome, Peta.
Thank you. Hi, Belinda. Thanks for having me.
My pleasure. I'm so glad you've been able to join us. I'll just introduce Peta more formally. So Dr. Peta Wright has a relaxed and compassionate attitude that will put you at ease knowing you're in capable, caring hands. She is a gynecologist, pediatric and adolescent gynecologist and fertility specialist. Dr. Peta Wright is deeply committed to all aspects of women's healthcare and founded Vera Women's Wellness in 2020. She strives to take a holistic approach to managing the health concerns of women of all ages and aims to help women work on these aspects of their lives as part of their overall health picture. For patients who are trying to conceive, Dr. Wright offers fertility care with a holistic approach, addressing diet, lifestyle, and environmental factors. If required, she's able to offer treatments with assisted reproductive technologies such as in vitro fertilization, IVF, intrauterine insemination, IUI, and ovulation induction. Peta is also passionate about helping women with pelvic pain, endometriosis, as well as polycystic ovarian syndrome, hypothalamic amenorrhea, vulvar concerns, painful sex, abdominal pap smears, and menopause medicine. In addition, she works with women experiencing premenstrual syndrome and premenstrual dysphoric disorder. It is Peta's dream to help women remember the beauty and power in their bodies and to give them back the tools and knowledge to live happy, healthy, and empowered lives. So I want to start, if you want to explain a little bit more about a fertility specialist and their roles for those women in the community that wonder if it's maybe down the path for them or know people who are tapping into that, just to help them understand that role a little bit more.
Sure. So being somebody who does fertility work, I'm a gynecologist, so trained as a gynecologist and an obstetrician. And then, so most gynecologists can go do some extra training and do a fertility medicine. I went and did some extra training and did a master's in reproductive medicine. And so what that means, I suppose, is that women or couples who are finding it difficult to conceive, and that's usually, we would say, after 12 months of trying and not being able to conceive, or if they're having some obvious clues that there might be something going on, like irregular cycles or pain or any other hormonal issues. Women or couples will come along and see somebody like me who will help to sort of get to the bottom of what the issues might be, and then come up with a plan to try to remedy that or come up with a solution in order to get around those obstacles so that women and couples can fall pregnant. People come to see me, I guess there's a few groups of people, the couples who are having trouble, and then also a growing number of women who are wanting to have a family on their own, and also couples who are in same-sex relationships who need a fertility specialist to help them get pregnant in terms of donor sperm and procedures like intrauterine insemination or IVF, if that's what they choose. I think that fertility, well, I don't think it, I know that fertility is a reflection of our underlying health. So I'm really big on understanding what are the root cause problems, and often if there's a fertility problem, there'll be other health problems that we can uncover, and then often, you can help to remedy them without things that we think about as standard fertility treatments like IVF and intrauterine insemination. And it might just be looking at restoring their normal ovulation or decreasing inflammation in their body in the case of endometriosis, or sometimes needing to do surgery in the case of endometriosis, but looking at making those lifestyle and whole body changes, which can have a huge impact on fertility, so egg and sperm quality. So it's not just about the woman, and then the whole overall environment of the body. So there's there's so much interesting research on the microbiome in the gut and also in the vagina and the uterus now that is really interesting and exciting. And so, and also a lot of research on things that we can do to improve our microbiome diversity, like exercise, diet, and stress management and sleep. And that can have a huge benefit to women with, say, polycystic ovarian syndrome or endometriosis or other conditions. So it's not just about procedural stuff. It's about looking at the health of the couple as a whole, and also I would say, like, looking at the connection between the couple, if it's a couple as well. You know, are there problems between the two of them? Is it a harmonious relationship? Are there any other psychological blocks to falling pregnant? I try to take a really holistic picture of all of those things, and then help the couple or the woman with a plan to address all of those things and optimize the environment in the body, and also create the best quality ingredients for fertility in terms of eggs and sperm, because you can do IVF with egg and sperm, but it's like a recipe. If you use ingredients that aren't amazing and you put them into an environment that isn't amazing, then you're not going to get amazing results. So not just those methods of IVF that are important, it's all addressing all of those other things.
Definitely. And so I know through my experience over the years, there's a certain time frame within which you sort of need to give your body sort of a lead-in time. What is how do you explain that to your patients, and what do you advise?
Well, I would say at least 3 months, because the egg takes about, from growing from a tiny little egg that is like immature, growing to be the egg that is going to be released and fertilized, that process takes around 3 months. So any kind of pre-fertility guide, I would say to be working on an anti-inflammatory whole foods diet during that time, reducing toxins like environmental toxins, chemicals, etc., alcohol, obviously smoking, looking at if people need supplements into their diet that can help with egg quality, and there are quite a few of those which have shown to help mitochondrial function and egg quality. And also obviously being on a really good quality prenatal vitamin around 3 months. And for men, it's about 4 months as well. So the sperm turns over, new sperm is made every 4 months. So it's a similar time frame. But I would say with a caveat that because fertility is a reflection of our underlying health, if our underlying health is great, our fertility in many cases will be good. Of course, there are conditions that no matter what you do, your lifestyle will help to a degree, but there may be other help. You may need other help. So it's not just about getting you healthy with the aim of conceiving. It's also getting you healthy to be healthy. So I say that's a lifelong thing. And if we can teach young women and young people about that, I think that would go a long way to perhaps not having the fertility problems we have in the first place. I always think that it's interesting that, say, for women, we have an idea about our state of fertility by, are we having an irregular cycle? Do we have fertile mucus? Are our periods, relatively pain-free? That gives us a lot of information. And if things are off there, we can correct it. But men, they don't have that information unless they do a sperm test. And so I would love to see men being more aware of the fact that their health, too much alcohol, smoking, definitely drugs like marijuana, high fat, trans fat foods, lack of exercise, that can all massively affect sperm quality, but they have no idea. There are great studies that show that sperm quality is really correlated, obviously not just with problems of fertility, but also with a greater risk of health issues in the man as they get older, like cardiovascular disease and high blood pressure and diabetes. So I think for men, understanding that fertility is a mirror of general underlying health is also really important.
So critical. That's right. And it's interesting that the women that I've spoken to over the years about their fertility journey, the trigger for them to look into their lifestyle has been the fact that they haven't been able to fall pregnant. So you're so right. Like if we look at the cycle before we have the fertility issues, we'll get that report card so much earlier and be able to set up that quality of life so much earlier and sustain that. Because not only is it going to affect your fertility, it then affects menopause as well and how that impacts.
And it affects your likelihood of diabetes, cardiovascular disease, dementia, all kinds of inflammatory illnesses. So I see that that lifestyle part, a very big part of the way I see women and couples. Yeah, and I mean, as I said, it doesn't. There are people who might have a blocked tube or severe endometriosis where things are stuck, or you know, where they may need extra treatment, but it's still going to help overall inflammation. It's not going to help the blocked tube, but it's going to. If more people were aware of that link, there would be less, I think, issues with fertility, and we'd be more focused on those other things that need more intervention. And I also say to couples, even if they end up needing to have IVF, working on the ingredients quality and the environment of where that little embryo is going to cook for the next 9 months, and that implantation environment is also super, super important. So I would always talk about diet and lifestyle and environment and stress and sleep and everything with my patients as well, even when they're undergoing that IVF process.
Yeah.
To help their success rate, but also to help them cope with the process and for their future health and longevity.
Yeah, definitely. That leads me to a question around, you know, how do you strike that balance between the right level of information so a person feels informed that they know what they're in for with the IVF or the different procedures, but because these procedures you don't need to know every single thing that you possibly need to do with IVF, because sometimes you go, the most simple of procedures will help them to succeed. And then other people, we have to go, well, actually, we're going to have to add this in now. And then, oh, actually, we're going to have to add this in now. How do you strike that balance between that minimum amount to get them the right amount of information and not scaring them so that they feel overwhelmed?
Can I just give you 1 second? Sorry, there's just something happening over there in the background. Can I just?
Yeah. Also recording. So we were just talking about that, striking that balance between, you know, the right level of information so a person knows what they've got in store and not being too overwhelmed.
That's a tricky one, because I think in this age where we have so much information at our fingertips anyway, and it's really easy as I guess people on this journey to be, you know, consuming lots of information about different procedures and studies and all kinds of things. It can be really difficult to decipher all of that and work out whether that's something that is right for you. And I mean, there are often things that are controversial even in the fertility world.
Yeah.
So that can be a difficult thing. I guess I would, and I'm very conscious of having of women and couples feeling very informed about their options, so that they're able to make the choice that they feel is right for them, but also giving them my, I guess, experience and opinion, and helping to guide them through that process, but having them be the person that makes the decision about what they do. And I guess also, I think the thing is taking it in a stepwise fashion. So, you know, when someone first comes to see me, we might be looking at investigating what are the potential causes of their problems. So we go down that, and then we make a plan for how to address all of those causes. And if there are options in treatment, we talk about, you know, the success rates, the risks, the potential side effects of each option. And some people might say, oh, we want to do IVF because there's a higher chance of success, even though it's more invasive and it's more expensive and there might be more side effects. And other couples and women might choose to go with a less invasive option, such as an IUI or making lifestyle changes for a time first, because that might be more important to them. They might end up at IVF in 6 months as well, but it's important to them for them to have gone through that process.
Yeah.
So I think explaining all of the pros and cons, and that there isn't generally a right or a wrong. And then, as you know, anybody who's been on a fertility journey knows, it evolves, and what starts out as, okay, I think the thing is, for many women and couples, they often feel like, if I'm going in for IVF, all right, I'm probably going to get pregnant the next cycle. And understanding the real reality and having those expectations set, that, you know, for most couples, it isn't a one cycle and they have a baby. For most couples, you know, it is at least 3. And understanding that it doesn't mean that if they have a failed cycle in the first 1 or 2, that they're not going to get pregnant, and that the success comes when, you know, you have the courage and the fortitude and the resilience and the support to be able to keep going to a point, obviously. But having those expectations realistically set, I think, is also really important for state of mind and for decision making.
Yeah, definitely. And that leads me to another question. You know, what are some of those red flags that you see that lets you know that your patients aren't quite coping mentally or emotionally? I mean, I know as a gynecologist, traditionally your role is looking after that part of the body, but I know from your perspective, being that holistic approach, I know that you take that into consideration. So what are some of those red flags for you?
Yeah, I think that's probably a strength of mine, in that it just cannot tell if someone comes into the room and their body language is different, or they feel flat, or like there's a big grey storm cloud over their heads, or they feel like they've lost that hope, or their anxiety is out of control. I mean, it can be a blessing and a curse. It can be a two-edged sword for me, in that I can feel what my patients feel very easily most of the time. So I guess I have a good intuition in that sense. And I think it is such for some women it's fine, and they've got a lot of support and they're very pragmatic. But for many women, it is a huge thing, financially, physically, emotionally. Yeah. And they've also trying to go about their lives as well at the same time, while they're doing this huge thing with a lot of hopes and expectations. So, I mean, I think even for anyone, even if they're not displaying those red flags, I'm not coping, is address, you know, what are their supports, what are their coping strategies, because I think they need that stuff around them when they're doing a cycle. And then if I'm seeing those red flags just in their body language and their demeanor, their energy levels, and I think also, like, people cry in my office all the time. I don't think that I hope that they find it a comfortable space to be able to let their feelings out, because I think a lot of women go through the rest of their lives, like, often not telling people around them what they're doing, trying to be strong, not saying anything to anybody, and keeping their feelings really tucked away. So I hope that when they come into my office, they can let that go. So I often recommend that women work with, if they don't have great support, or they feel that they need extra help, that they that they might talk to a counsellor or a psychologist. Or sometimes, you know, we're perhaps a bit different here at Vera. We have a beautiful yoga teacher. She does Reiki. I know you do Reiki. And she is fantastic for women as well in that space, who need even just a bit of grounding and some tools like mindfulness or meditation, breath work, yoga, to help them through that 2-week wait, to help manage their anxiety, to help surrender. Because I think often that's the biggest thing with fertility, is that many women and couples have gone through their whole lives to an extent with the illusion that they can control everything and can control the outcome. And if I just work hard enough and I just do all the right things and I'm good enough, then I'll get the outcome I desire. And fertility journeys, I feel, is like this huge reminder from the universe that none of that's actually true, that we actually don't really have control over anything.
Oh my goodness, no.
And that's a very difficult realization for people. So it's almost like a big sort of spiritual experience for a lot of people if they let themselves get that lesson, even though it can feel really hard. And it's a huge lesson or opportunity to learn to surrender, because you can be doing everything. Like, you can be in the hands of your fertility specialist, you can be doing all your supplements, doing all your lifestyle stuff, doing all the drugs, having everything as micromanaged and controlled as you can. But at the end of the day, there's that thing that we just have to then surrender and let go. And I think when people can get to that point, or if they need help and tools to do that, there's a lot less suffering in the experience, and there can, dare I say, even be a beauty that they can take into the rest of their lives, especially when they get their children, because then that's the next big lesson on the fact that you can't control anything.
That's right.
So I think that they're all really important things. And also the impact of stress on the body. And, you know, of course, there's not been a huge amount of studies, but the impact of stress on inflammation, immune system is all really well understood. And I never like to say that, you know, a woman's stress can impact their chances of falling pregnant, because I don't want to blame anyone or make them feel, if they're struggling, to let go, that it's their fault. But definitely, if we can be in a more relaxed state where our cortisol and adrenaline are lower, our immune system's working as it should, inflammation lower, all our hormones are working well, that's a better environment to facilitate, you know, a little baby wanting to hang around. And to cut through the process.
Yeah, that's it. Like, I just was talking to another lady yesterday about how that process of IVF can heighten that stress level because of just how much pressure is on it, because of how expensive it is, and how much you're putting your body through and your mind through, that that can flow on through the pregnancy. I know I experienced that in my first pregnancy, because I was so wound up from the 3.5 years of fertility treatments and 3 rounds of IVF, and finally getting there and just like, this has to work. And it was really, really, really stressful. But I do remember when, and you're talking about that spiritual kind of process. I mean, I wouldn't be where I'm at now if it wasn't for my fertility journey. I came to that position of knowing, you know, it happened for me for this reason. And I know that took me a long time to do that. And then I can now guide women through, well, what are those steps that they can take, that'll take less than 10 years for them to get to. But it is that what will be, that acceptance. And it is very hard for us type A personality women who, as you say, you know, we're used to controlling things. They're probably in high level professional roles where they ask something to be done, it gets done. And then, you fall into the fertility realm and that it doesn't play out that way anymore.
No.
So I'm hearing that, you know, there's definitely bits of advice that you've been sharing throughout, but what are some last little bits of advice that you could give to the women in my community that would help them cope a bit better, or be ready if they're on or about to face a fertility journey, or even recovering from?
I really think, I think that the best advice I can give is, if you find yourself in a journey, because a lot of women don't expect to be there as well. It's that thing of, they just thought it would happen and it hasn't. I think I would say using it as an opportunity to change your mindset, or to work on mindset, because the situation that you're in is as it is. And I think that a lot of the suffering and the struggle and the anxiety and the depression comes from wanting it to not be that way. And it is that way. And I think coming to that place of acceptance, and then be like, okay, I'm here. And so what are the people, who can I support, who can support me? What options do I have? seeing somebody or a team of people who can lay out your options in a really straightforward way can make you feel empowered in decision making, so that you don't feel like it's yet another place where you have no power or control. Like, as I said, you do have to surrender, but you should be the person in the driver's seat of your journey with good advice.
Yeah, knowing that right. It's an intentional surrendering, isn't it?
Yes, knowing that you've got some good navigators beside you, you know, and that there will be going into it expecting that there'll be twists and turns that you might not expect, right? So I think that's a big thing to think about, and just to try to be a bit more easeful with, I suppose. The other thing I would say is that sorry, can you just cut the recording for 1 sec? Sorry. And the other thing I would say is, so you're on this journey, you've got your navigator and your team, you're empowered where you can be. And I think also feeling empowered and knowing that we do live in this amazing age where we have so much technology. There's so many options for women, you know, that may not have been able to fall pregnant in the past. So actually, like, instead of thinking about this journey like, oh my God, it's this thing that I never wished for, and I wish that it was different. And of course we wish that to an extent, but now that we're in it, feeling grateful that we have the resources and the teams and the communities and the technology that can help you to achieve your goals. And there are so many ways. The other last bit of advice I would say is be flexible in your thinking with how you're going to achieve your goals. So I say that as an example for a couple who might have done lots of IVF. They might be really struggling to have good quality eggs, and women might be older, and they might get to the point where, for their own, you know, well-being, and with the, you know, statistics on how the chances of success with their own eggs, they might make the decision to use an egg donor or an embryo donor, or create a family in a way that is maybe different to what they would have expected. But that is no less of a family, and families are created in all different ways. And it's just getting flexible on your thinking about how you might create your family. So if one road is like, no, can't go down this one, then look for the other roads around you, you know. So I'd say flexibility in thinking and surrender is so important on this journey.
Yeah, definitely. Thank you so much for sharing your wisdom and your advice and your time with us this morning, Peter. There was some really beautiful gems in there for women to consider. And I've said it before and I'll say it again. I reckon if I'd had you on my journey, it wouldn't have been 9 years. It probably would have only been a much shorter journey. So you've very lucky patients who work with you. So thank you so much for your time. Really appreciate it. And we'll pop Vera Women's Wellness link in the comments below within the group, so that people can find you. That's the best way to get in contact with you, isn't it? Through that website. Yeah.
So you can just contact email. It's hello@verawomenswellness.com.au, or you can send us a message on our Instagram page as well. And thank you very much for all the work you do, because, as you know, I think mindset and stress and surrender are such an important part of this journey, and you do such important, wonderful work in this space that we've talked about before. It doesn't just translate into how someone's feeling at a headspace level and how they're coping, but it can change your physicality and your biochemistry in your body, which can then, you know, is seen in fertility and how your body's working. So it's also a really crucial part of this journey. So thank you.
Oh, my pleasure. And it came about because of my fertility journey.
We always have to look for that silver lining, I suppose, and what we can learn.
Yeah, that's right. Thanks again, Peter.